Mental health matters. It's a crucial part of our overall well-being. It's as vital as our physical health. Just like we take care of our bodies, we need to nurture our minds. Yet we often treat it differently. Mental health issues are frequently overlooked or misunderstood. We wouldn't ignore a broken leg. We seek immediate help for physical injuries. So why ignore a mind in distress? Millions suffer in silence, feeling isolated and alone. They face an invisible epidemic, one that affects their daily lives and overall happiness. This is a global crisis. Mental health issues know no boundaries and affect people everywhere. We need to talk about it openly and honestly. Conversations can break the stigma. We need to act on it. Advocacy and support can lead to real change. Mental health is not just the absence of illness. It's about well-being and thriving in life. It's about coping with life's ups and downs and finding joy in everyday moments. It's about fulfilling our potential and achieving our dreams. When our minds are healthy, we thrive. We build stronger relationships and communities. We connect. We contribute. We make a positive impact on the world around us. Unfortunately, many face barriers to getting help. These barriers are complex and deeply rooted in our systems, but they are not insurmountable. With collective effort, we can overcome them. By understanding these challenges, we can start to dismantle them. We can create a more supportive environment. We can create a world where everyone gets the mental health support they need. Together, we can make a difference. The statistics are stark and undeniable. They paint a picture of a growing crisis that affects us all. According to the World Health Organization, 1 in 4 people globally will experience a mental health condition in their lifetime. This is a staggering statistic that cannot be ignored. Depression and anxiety are among the leading causes of disability worldwide, affecting millions of lives. In the United States alone, nearly 20% of adults experience mental illness each year. This means that 1 in 5 people you know could be struggling. Suicide rates have been steadily increasing, claiming tens of thousands of lives annually. Each life lost is a tragedy. These numbers represent real people with real stories. They are friends, family members, colleagues, and neighbors, people we interact with every day. Behind each statistic is a story of struggle and suffering, often hidden from view. The human cost of untreated mental illness is immeasurable, affecting not just the individual, but everyone around them. It affects individuals, families, and communities, creating a ripple effect that touches us all. It impacts productivity, relationships, and overall well-being, leading to a cycle of distress. The time to act is now. We must come together to address this urgent issue. We can no longer afford to ignore this crisis. It's time for change, for action, and for hope. Accessing mental health care can feel like navigating a maze with invisible walls, where every turn seems to lead to another dead end. One of the most significant barriers is the sheer shortage of mental health professionals, particularly in underserved areas, where resources are scarce and help is hard to find. This shortage leads to long waiting lists, sometimes stretching for months, leaving individuals in a state of prolonged distress. This delay can be devastating, forcing individuals to endure their suffering in silence, often exacerbating their conditions. The financial burden of mental health care is another formidable obstacle, with costs that can quickly become overwhelming. Many insurance plans offer limited coverage for mental health services, leaving gaps that patients must navigate on their own. This leaves individuals grappling with high out-of-pocket expenses, making treatment inaccessible for many who need it most. Cultural stigma also casts a long shadow on mental health, creating an environment where seeking help is often frowned upon. In many societies, mental illness is shrouded in shame and misunderstanding, making it difficult for individuals to come forward. This leads to discrimination, self-stigma, and reluctance to seek help, further isolating those who are already struggling. Section 4. Breaking down the barriers, a collective effort. Addressing the mental health crisis requires a multifaceted approach. We need to invest in expanding our mental health workforce. We need more therapists, counselors, and psychiatrists. We need to make training more accessible and incentivize professionals to serve in underserved communities. We must advocate for policy changes that ensure mental health parity. Insurance companies should be mandated to provide equal coverage for mental and physical health. This includes therapy sessions, medication, and inpatient care. Breaking down cultural stigma requires open conversations and education. We need to normalize mental health challenges and create safe spaces for people to share their experiences without fear of judgment. Section 5. Hope and healing. You are not alone. If you're struggling with your mental health, please know that you're not alone. Reaching out for help is a sign of strength, not weakness. Talk to a trusted friend, family member, or healthcare professional. There are resources available to support you. Remember that recovery is possible. With the right support and treatment, you can regain control of your mental well-being and live a full and meaningful life. We all have a role to play in creating a world where mental health is valued, supported, and accessible to all. Let's break down the barriers together.